So, okay, am I audible? Okay, okay, okay. So, mental diseases of doubtful origin. So, the mode of declining of this point, mode of deciding of this point will be that if proceed from one or other of the later causes, it will diminish and be improved by sensible, friendly exhaustion, consolatory arguments, serious representation, and sensible advice. Okay, this is for those which is originating from bad practices, which is originated nowadays. You will see the people is biased with their opinion, with their political opinion. Okay, they will fight. They will be biased with their political opinion because they are seeing what they are being shown. They are not aware of the other fact. They are suffering from bubble effect. Okay, on the social media, they are bombarded. On the social media, they are bombarded with the information of counter narrative. Okay, they don't know the two sides of a single narrative. So you will see people who are being told as blind. Okay, with their opinion, they are blind with their opinion. Because why they are blind, becoming blind? Because they are suffering from bubble effect. They are seeing what they have been shown. Okay, nothing else. They don't want to see anything else. So it's a kind of mental diseases where the patient is biased with his single side of narrative and single opinion because he is not aware of the other facts. So with them, you must have many friends who are suffering from these. With them, it will diminish. Okay, with them it will diminish by improved, sensible, friendly extortion, consolatory arguments, serious representation, and sensible advice. Okay, people are becoming zombies with their opinion. Okay, they are not ready to accept others' opinion. Okay, this is also a kind of mental illness, you can say, that people are ready to kill one another because of their single thought, their one-sided narrative. Okay, so this is also a kind of amygdala reactions they are giving. What is amygdala reaction? We may discuss at some other point. But now come back to our mental diseases. Would be whereas real, moral, or mental malady, depending upon bodily disease. When we were in our 4th year, this was our question in BHMS. What is real or mental, real, moral, or mental malady? Okay, this was our question in university paper. Okay, many people have incorrectly answered as that emotional, those diseases which are originating at the mental sphere itself are the real or mental sphere. This was a question of 20 marks. Okay, and just if you are unable to identify, that first question, what is real or moral or mental malady, then the whole question will be wrong. So this was the question in our university exam. 20 marks question was there. The first question was this, and another subsequent follow-up questions were there. So many people have incorrectly thought that emotional diseases which are originating at the mental sphere are actually the real mental or moral malady. Okay, but that was not the case. Clear? So the real or moral or mental malady, depending upon bodily disease, this is real mental or moral malady, would be speedily aggravated by such a course. Which course? That sensible exhaustion, consolatory argument, serious representation. If your friend is agitated, okay, on your argument, serious arguments and friendly exhaustion, think that the disease has traveled to corporeal state. Okay, no one can save him now except the homeopathic correct treatment. Now will become more melancholic, will become more, still be dejected, querulous, inconsolable, and reserved. The spiteful maniac would thereby become still more exaggerated, and chattering fool would become manifestly more foolish. Okay, will become more foolish. So नारियल है, एक पूरा नारियल है, the whole coconut is there, whether there is coconut solid or coconut water. Okay, so if it is coconut solid, it will present a different picture. If it is coconut water, it will present a different picture. But the third kind is the samucha nariyal itself, the whole coconut itself. So mental diseases of doubtful origin. Okay, 25. There are, however, as just been stated, certainly a few emotional diseases which have not merely been developed into that form out of corporeal. Okay, out of corporeal. This has not come out of corporeal, but which is in inverse manner, the body being but slightly indisposed, originate and are kept up by emotional causes such as continued anxiety, worry, vexation, wrongs, and frequent occurrence of great fear. Underline this: frequent occurrence of great fear and fright. Okay, this kind of emotional diseases in time destroys the corporeal health, often to a great degree. Okay, so frequent occurrence of great fear we have discussed regarding this, that aconite, for a single incident of fear, think of aconite. For a recurrent event of fear, think of opium. Okay, for a single incident of fear, think of aconite. For a recurrent incident of fear, think of opium. Okay, and even if that fear is 10 years ago, Dr. Babu, I was never been able to overcome that fright. Okay, I was going in dark and all of a sudden I was frightened and I have never been able to overcome that incident of fright. Think of aconite. Okay, doctor, every night, even if it is 10 years ago, every night I was frightened, I was terrified by the darkness, by a call, by a letter, by a sound. Every night I was frightened. Every night I was frightened. Think of opium. Okay, these are the neurochemicals, which is, it is my theory. It is I have theorized in whole this year that there are certain neurochemicals coming out. Okay, for in reaction to fear, there are certain neurochemicals which is coming out in reaction to grief. There are certain neurochemicals which is coming out in reaction to anger. These emotional outbursts resulting in excess of neurochemicals, and these neurochemicals may be deposited somewhere in our brain, somewhere in our body, which is troubling and initiating a disease. Okay, so your role is to actually to drain these neurochemical, and maybe ignitia is helping to drain the neurochemical of fright, of grief. Aconite is helping to drain the neurochemical of fright. Opium is helping to drain the neurochemical of recurrent fear or fright. Okay, and sap is the medicine which is helping to drain the neurochemical of recurrent anger, mortification, insult. Okay, so this is, in this way you can think, and for that also you may give, if the susceptibility of patient is high, okay, still giving so many symptoms. If the susceptibility of patient is high, you may think of giving a single dose in high potency. If the susceptibility is low, you may think of giving a low potency repeated dose. Like Ignitia 30, I am using recurrently in lower potency for the lower susceptibility of patient who have gone through grief and There is no other symptom but the history of grief which has devastated your patient. And in that kind, think of ignitia in lower potency in recurrent doses, okay, repeated doses. Likewise, think of aconite 1 m in single incident of fail, the susceptibility is high. Think of aconite in lower potency in repeated doses, okay, if the susceptibility is low. How you will decide the susceptibility high or susceptibility is low, we have discussed in our previous lectures, okay. Now, what this kind of diseases are doing, these are actually in time destroys the corporeal health. You will see that this is again falling under what? This is again falling under the inappropriately named chronic disease, okay. A constant state of anxiety, a constant state of fear for failure of business. He's thinking that my business will fail. He's thinking that my business will be failing. So try to make your patient understand that nothing is going to happen even if your business is failed. Okay, like that Dunya we have discussed in some classes, who was stuck with itna rui kaun tunega, who will beat this much cotton, and the physician cured him with a deception. With a deception, what was that? The deception was the ship has sank. Okay, na rahegi baas, na bajega bansuri. Okay, that was the moral remedy we have discussed in the aphorism number 17 footnote. Okay, and these are also the moral remedies. Improved by sensible, friendly extortion, conciliatory argument, serious representation, sensible advice. What are these? These are actually the moral remedy. Okay, so number 225 is dealing with the this mental diseases originating on the emotional plane. Mental diseases originating on the emotional plane. Clear? Now, it is only such emotional diseases, number 26. This is one of the location for placebo. There are many location in the aphorism where Hahnemann is advising for placebo, like 93, okay, like 17 footnote, like here. It is only emotional diseases, such emotional diseases. Which emotional diseases? Which is originating from here, which were first engendered and subsequently kept up by the mind itself. First engendered, originated in the mind and kept up, subsequently kept up by the mind itself. That while they are yet recent and before they have made very great inroad in the corporeal state, may by means of psychical remedies. This is psychical remedies, moral remedies, okay, same thing, such as display of confidence, friendly extortion, sensible advice, often well disguised deception, that is the ship has sank, okay, be rapidly charged into healthy state of the mind, rapidly change into a healthy state of mind, and with appropriate diet and regime, that is discussed in 228 and 229, okay, seemingly into a healthy state of the body also, okay. 227. Now here also 227, here also in these kind of diseases also fundamental cause is sora. If sora was not there, these diseases, this kind of anxiety neurosis, excessive anxiety, excessive fear would not have been crept in the mind, okay. So but fundamental cause in these cases also is soric miasm. Underline this, is soric miasm. Fundamental cause in these cases also is a soric miasm, which was not only yet quite near to its full development, and for security's sake, underline this, for security's sake, the seemingly cured patient should be subjected to a radical anti-soric treatment, okay, a radical anti-soric treatment, in order that he may not again, as might easily occur, fall into similar state of mental disease. Okay, so here also you need to give antisoric treatment. Okay, okay, along with the psychical remedy, along with those moral remedy. Okay, now 228 and 229 is dealing with the auxiliary mental regime, that is appropriate diet and regime. In 226 hints is given. Now in 228 and 229 is nothing but dealing with the, it is dealing with the auxiliary mental regime. What should be done? Here it is there. No, you should know that these are Hahnemann is proposing in 1833. Okay, so currently it came in 1843 also. In 1833, and after 100 years, these were the changes introduced in the psychical treatment. You will see that very recently, 50 years or 60 years before, people were given mental shock, electric shock. In TV dramas, you are able to say still now in old films that electric shock is given to a mental patient. Okay, we don't know the rationality behind such treatment. Okay, but these existed until very recently in the psychical treatment of patient. Okay, Hahnemann is proposing these mental and auxiliary regime 100 years ago before them, 150 years before them, that this should be done, and what should be done and what should not be done. So Organon is still relevant. One of the points why Organon is still relevant is this, that Organon was advanced of its age. So in mental and emotional diseases like that also, every chain, which 83 footnote, every interruption breaks the chain of thinking, is the modern psychoanalytical school's method of catharsis, that they don't interrupt their patient, they let their patient go on talking. Okay, so that is also Hahnemann was telling around 100 years before Freud. Now, in mental and emotional diseases resulting from corporeal maladies which can only be cured by homeopathic antisoric medicine conjoined with careful regulated mode of life and appropriate psychical behavior towards the patient, underline this, appropriate psychical behavior. For those who are in their BHMS, for their university examination, the treatment part will be consisting of those which I have discussed in the last classes, and today treatment part will consist of those plus this these mental auxiliary regime 28 and 29. Now, which can be cured by homeopathic antisoric medicines conjoined with a carefully regulated mode of life and appropriate psychical behavior toward the patient on the part of those about him and of the physician must be scrupulously observed by way of an auxiliary mental regime. Underline this. Auxiliary mental regime. To furious mania, we must oppose a calm intrepidity and cool firm resolution. To furious mania. Condition is furious mania. What we should do? We should do this. Three things. Now, to doleful querulous lamentation. Okay? जो झगड़ा कर रहा है, चिल्ला रहा है, चीख रहा है, उसके लिए a mute display of commiseration. What is commiseration? Expressing sympathy. Yes, I can understand. In looks and gesture. Mute display. Don't tell anything. Okay. Consolation aggravates the mental symptoms. To senseless chattering. To senseless chattering. कुछ बोल रहा है, मेरा ये हो गया, मेरा वो हो गया, ऐसा वैसा. A not wholly inattentive. To distinguish an abdominal conduct. To disgusting and abominable conduct. Okay, very bad conduct, disgusting, and to conversation of a similar character. total inattention. You are not hearing anything, as if this is the mental mental regime. You should write at one part of the table, give a line in between, like the condition furious mania, and what to do, this. Write the condition doleful lamentation. What is this? What is the thing you should do? This. Write the condition senseless chattering. This. Okay. Abominable conduct and conversation, and what you should do, this. Okay. We must merely endeavor to prevent the destruction and injury of surrounding object without reproaching the patient for his acts. Okay, without punishing the patient for his act, and everything must be arranged in such a way that necessity of any corporeal punishment and tortures whatever may be avoided. Okay, this is so much the more easily effected because administration of the medicine, the only circumstances in which the employment of coercion could be justified. जबरदस्ती खिला पिला रहे हैं, medicine खिलाना ही पड़ेगा. In homeopathic system, the small doses of appropriate medicine never offend the taste and may consequently be given to the patient without his knowledge in his drink. So all the compulsion is unnecessary. Even the compulsion which may be there in cases of medicine only. You have to give the patient your medicine. Recently, 2-3 days back, I think, or 2-3 weeks back, a lady came to me and told that his husband is becoming very obnoxious, okay, telling anything shamelessly in front of children. Okay, I diagnosed the case as a sense a kind of neurosis. Patient needs treatment here, but he is not willing to come to doctor or going to doctor, but doing obnoxious things there. So I have given my medicines on the basis what the lady told me. I have given him sulfur 10 mg to be mixed with any food item, in any drink item or food item to be given, and lady reported the improvement in her husband's behavior. Okay, so the medicines may be given in this way. One lady complained me about his husband's addiction to alcohol. Okay, so I gave syphilinum to that person to be mixed with some drinks or some beverage or some kind of food item. Okay, so it is not going to offend the taste of the food item, and the patient may take without actually knowing there is medicine. What should not be done here? Mental regime. What should not be done here? 229. On the other hand, 228 was what should be done. 229, what should not be done. Okay. On the other hand, contradiction. नहीं यही सही है. Okay. ये अगर explanation, rude correction, and invectives, okay, and also weak timorous yielding are quite out of place with such patient. Okay, they are equally pernicious mode of treating mental and emotional maladies, but such patients are most of all exasperated, and their complaint aggravated by continually by insulting language or treatment. Okay, to your blind friend who is actually blind with his the political opinion, don't insult him. Okay, and don't try to show him the truth, but listen to him. Okay, listen to him and have sympathy towards him, and he will be corrected. Aggravated and continually fraud and deception, and they can detect fraud if they can detect that. Okay, now this was happened to me. I have told you that in our UG days, due to excessive ragging, one of our batchmate turns into insane, and he was running with a rod in his hand to everyone. Okay, I went to him. Again, there was an attack in second year when I decided to live in hostel. At that point of time, again that friend was attacked with insanity, and I went to him trying to give him medicine, and he detected, and he became suddenly furious with me. Okay, and he started to throw things, and I was just like others came and pulled me out of the room, and it was okay. I tried to give him stramonium due to, I was in second year. I tried to give him stramonium due to his furiousness, okay, in his drink or some food, and he was talking with me very mildly, and I was also depending upon these, because I have read all these because of him also only. So I went him to give him medicine in some drink and that, and he all of a sudden he become furious because he detected that I had tried to mix the stramonium in his drinking bottle. Okay, if other have not pulled me out of that room, I would have, anything would have happened that day. Okay, so that will be aggravated if they detect that you are giving a fraud. Okay, the physician and keeper must always pretend to believe them to be poses of a reason. Okay, that they are not pagal. They have a reason. They are not pagal. हर पागल बोलेगा मैं पागल नहीं हूँ, and you have to accept that मैं पागल नहीं हूँ. Yes, he is not pagal. All kind of, you must have heard this famous dialogue. हर पागल यही बोलता है कि मैं पागल नहीं हूँ. Okay, so you have to accept that सामने वाला पागल नहीं है. All kinds of internal, external disturbing influences on their senses and disposition should be possibly removed, and there are no amusement for their clouded spirit. They cannot enjoy. No salutary distractions, no means of instruction, no soothing effect from conversation, books, or other things for the soul that pines or frets. Pines, loathing, missing, frets, irritated, anxious, in the chain of diseased body. Underline this. No invocation gives strength of energy for it, but the care. It is only when the bodily health is changed for the better that tranquility and comfort again beam upon their mind. Okay. A new footnote added to that. The treatment of violent, insane, maniac, and melancholy can take place only in an institution specially arranged for their treatment, but not within the family circle of the patient. Okay, this is the suggestion of Hahnemann for mental asylums. 229. This is often a question in your MCQ, that in which aphorism Hahnemann has suggested for a mental asylum. That is 229. 6th edition. You will get 229 6th edition, 229 5th edition, and remember this is 229 6th edition. Now 230. 230. If the antisoric remedies selected for each particular case of mental or emotional diseases, there are incredibly numerous varieties of them. Be quite homeopathically suited for faithfully traced picture of morbid state, which if there be sufficient number of this kind of medicine known in respect of their pure effect, is ascertained by indefatigable search for the most appropriate homeopathic remedy, all the more easily as the emotional and mental state constitute the principal symptom of such patient is so unmistakably perceptible, then most striking improvement in no very long time, which could be thought up by physicking the patient to death with largest, often repeated doses of all the unsuitable medicine. Indeed, I can confidently assert from great experience that the vast superiority, underline this, the superiority of homeopathy over the allopathy can be shown with the treatment of mental diseases. Okay, Underline this line. Vast superiority of homeopathic system over all the conceivable method of treatment in no way are displayed in a more triumphant light than in the mental and emotional diseases of long standing, which originally sprang from corporeal maladies or were developed simultaneously with them. Underline this. Okay, this paragraph is important of 230. So superiority of homeopathic mode of treatment over allopathic can be displayed here in the treatment of mental diseases which are originating from corporeal diseases or simultaneously with the corporeal diseases. We have ended aphorism number 230, where we have dealt with the treatment part of the mental diseases. Excited by this last paragraph, in our PG days, we went to Mother Teresa's charity, where there at DNA hospital there was a mission, charity mission, sisters mission of charity, like that, the Mother Teresa's organization, and there we heard that their mental asylum is there. We went there to ask them for our homeopathic treatment, but sadly they rejected for that. Now, if someone of you want to treat, are interested in psychological diseases, may do their MD in psychology and then went on to treat mental diseases with their homeopathic. There are few people in India, only you can count them on finger. I know 2 or 3 of them. 2 are in Bengal itself. One is Dr. Gautam Banerjee and other is Dilip Bhattacharya. These 2 people are working on mental diseases and patient of psychological disorder. And one in Delhi, he was working, I don't know his name. He came to our college, DNA. We invited him for our monthly seminar by our PG committee, and he narrated so many cases of schizophrenia treated in the mental asylum, allopathic setup with homeopathic medicine. Okay, so if some of you are interested, this is not an easy path to take, okay, because there is so much hard work you have to do. So if any one of you have a passion in treating psychological disease plus means of doing, he has a backup, a strong financial backup for doing this, these works, they can go with them. But once they have established in this, they will get lots of patients, because there is a vacuum of homeopathic physicians who are treating mental diseases, okay, exclusively. For your practice, you can practice in general, or you can choose your field, okay, like someone chooses a field of infertility, someone choosing field of renal diseases, someone choosing field of psychology, okay, like this kind of specialized practice is also a mode of doing practice. Okay, now 231 onwards is dealing with the intermittent diseases. From next class onward, we will deal with the intermittent diseases. 231 to 244. I think 231 to 244. Okay, because from 245 onwards, another chapter starts. Okay, any question you are having, you can write in the chat box. Anyone, any question? Okay, you can ask microphone. So no question. Thank you. You have understood everything. Thank you for giving your attention. If you have any problem after seeing this recorded lecture, if you have any question in your mind, any doubt, you can ping me personally in WhatsApp or ask me in the group. Thank you for giving your attention.